Welcome to all of you to this Conversations with Leaders topic of caregivers in Canada. I'm Monica Patton, and I'm the chair of Compassionate Ottawa's Board of Directors. Compassionate Ottawa acknowledges that we are located on the unceded territory of the Anishinaabe Algonquin Nation. We work here and pay our respects to Indigenous elders, past, present, and emerging. Bienvenue à tous. Je veux dire quelques mots sur notre organisation. Compassion Ottawa est un mouvement qui renforce la capacité des citoyens d'Ottawa à être plus capables et confiants à s'aider eux-mêmes, leur famille et leur communauté à bien vivre, bien mourir et bien vivre leur deuil. Through workshops, conversations, research, and special projects like the Healthy End of Life Project and Let's Talk About Later Life, we work with others to change attitudes about death and dying, to encourage building networks of care, to tackle loneliness and isolation. And also with others, we ourselves continue to learn and to take on current community-wide issues, such as the one we're talking about today, caregiving and support for caregivers. All of our work intends to build the capacity of individuals, families, and the whole community to care for each other so that everyone can live as well as they can for as long as they can. Today, we have a conversation between two wonderful and accomplished experts on a topic that I think we would all agree is a wicked problem in Canada. That is the topic of caregiving. Let me first introduce Janet Dunbrack to you. Janet is an active Compassionate Ottawa volunteer, including in the work of our new caregiving support team. She's a former executive director of the Canadian Hospice Palliative Care Association, former chair and currently also a volunteer with Hospice Care Ottawa. And Janet has a long track record as a policy consultant in palliative care and many other areas of healthcare as well. We're honored that Janet has chosen to volunteer with Compassionate Ottawa and to be in this conversation. So I invite you now, Janet, to introduce Kelli, if you would, with much appreciation from all of us.
Thank you, Monica. Hi, Kelli. Dr. Kelli Stajduhar is a professor in the School of Nursing and the Institute on Aging and Lifelong Health at the University of Victoria. She's worked in oncology, palliative care, and gerontology for 30 years as a practicing nurse, educator, and researcher. Her clinical work and research is focused on health service needs for those at the end of life and their families, and on the needs of marginalized and vulnerable populations. Kelli is also past president of the Family Caregivers of British Columbia, and congratulations are in order, Kelli. You've recently been inducted into the Royal Society of Canada.
Thanks, Janet.
Yeah, it's a large topic, Kelli, that we have to talk about today, and I thought it might be helpful just to define what we mean by caregivers, so that we're all on the same page with that. So here's a short definition. Caregivers are people who provide personal care to a family member, friend, neighbor, partner, etc., someone who's close to them, a person who has a physical or medical condition, illness, or disability. It's generally understood, certainly in Canada, that caregivers are unpaid. So, Kelli, caregivers in Canada, there are about 9 million of us who are caregivers in Canada now. Big topic. What's top of mind for you when you think about caregiving in Canada?
Yeah, I think one of the things, well, first of all, I want to first say thank you for the invitation to be in conversation with you, Janet. I wouldn't call myself an expert any more than you are an expert in this field. But what is the top of my mind is that the issue of, I mean, we're probably many people on this call are caregivers themselves. or many are looking at the possibility of becoming a caregiver, or might be a caregiver, but don't actually realize they're a caregiver, or people who are seeking to support caregivers. And I guess, that 9 million number of caregivers, I think what's top of mind for me is it really underscores how much contribution people in our communities and in our country are making to the care of others. And yet at the same time, we see not a lot of caregivers at policy tables, at decision-making tables, at places where people need to be to inform the kind of decisions that are being made about how we best support those in our community. And it's, I've been doing work with caregivers for most of my career. It's always been invisible work. You mentioned it's unpaid work, but it's often invisible. And it doesn't seem to be out there in the public domain in the ways that we might hope to be able to influence changes in the ways that care is delivered in our country. Caregivers themselves are providing tremendous contributions. I think based on recent calculations, believe it or not, about $120 billion a year of care is provided by caregivers in our country. And I think you pointed out to me, Janet, that's about 3 times more than what we pay for healthcare in Canada. So this is not a minor contribution. And on the one hand, I would say that most Canadians are eager to take up the role of caring for each other, and people in our communities take up the role of caring for each other. But it's invisible labor. And when we have invisible labor, it comes with some consequences, I would say.
Yes, for sure. And one of the consequences is that the largest group of caregivers is in the age group of 35 to 65.
Yeah.
Which are people who are working, raising families often, and taking care of aging parents and children.
Yeah.
So they bear a lot of cost simply because a lot of them are working. They may have to take time off work.
Yeah,
and
it's
lose their jobs.
Yeah, it's not only a tremendous financial strain for people who are particularly in those age groups, but it's also affects employers in major ways as well. Because if you think about 9 million people being caregivers in our country, of which a large majority of them are in that kind of middle age group, and they're having to take time off for caregiving. And, on average, caregivers provide almost 20 hours of care a week. So, some of that is happening outside of work hours, but some of it, appointments, that our systems are set up for everything Monday to Friday in the day. So, employers are also, seeing kind of, what happens when employees who are also caregivers are affected, because it also affects people's capacity to work. And I think, those caregivers that are, you'll kind of have young caregivers. So, many people think of caregiving as, we're middle-aged and caring for older aging parents or siblings, but there's also quite a large contingent of young caregivers in Canada as well. So, this is not just an issue, for certain age groups. This is an issue for people across a lifespan. I've met caregivers as young as 14 and 15 that are providing substantial amounts of care for parents who are ill, for example, who are also trying to go to school, have a part-time job, daughters and daughter-in-laws and sons-in-laws and sons who are caring for aging parents or their partners or spouses or disabled children, and then older adults who are, often maybe having some of their own health issues who are also trying to provide care for their partner or spouse who is also aging. So this isn't just an issue of a certain group in our community. It's an issue for all of us, and it's one that is largely invisible. It's not funded, and I think it doesn't come without health and social consequences for people.
Mhm. You've given me an opportunity. I was going to save this to the end, but I'm going to share it now. Speaking about young caregivers, there are an estimated 1 million caregivers aged younger than 18.
Yeah.
And there's a Young Caregivers Association actually started in the Niagara area of Ontario. But I would like to read you in Dylan's own words. Dylan's a young caregiver. My name is Dylan. I'm a young caregiver. I take care of my mom because she has diabetes. Every day I'm reminded to take her pills, label them, and I leave her notes. When my mom needs time to rest, I go out to the park so she can have some alone time. One morning I went to wake up my mom and I realized she couldn't talk. I decided to grab the phone and call 911. When the ambulance got there, they told me they were going to take her to the hospital. They told me that she was going to be okay because I called them in time. This moment made me feel happy because my mom was going to be okay. Powerhouse program from Young Caregivers makes me feel good because they help me get over my stress and let me have fun. And the Powerhouse program Dylan's referring to is a program developed to teach young caregivers life and personal development skills, provide opportunity to connect with other caregiving kids, bring caregiving families together, and reinforce self-care. And I want to say Dylan is 8 years old.
Yeah.
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 So
A lot of responsibility for an 8-year-old.
Yes. And there are some, if you go to the Young Caregivers Association website, you'll see little accounts of caregiving from people as young as 5.
Yeah.
Yeah. So it touches everyone. It's often been identified too recently as a women's issue. It's assumed that women are going to take over the caregiving job. But the figures for Ontario show that it's equaling up. About 55% women, but 45% of caregivers now are men.
Mm-hmm.
So it's not as gender, identified as it once was.
As gendered, and I think also that women are also often seen as kind of the natural caregivers, and a lot of men that I've worked with who take on caregiving roles sometimes are well equipped for those roles, but in other circumstances haven't necessarily been the person in the family who has historically taken on things like domestic things, making appointments, doing, giving physical care. So for all people, I think these are new roles, but I think, there probably is some other considerations around caregiving, caregiving in the context of, whether you're a man or a woman or identify yourself in other kinds of gender identities. So I think, of course, everybody's caregiving experience is unique, and we wouldn't want to make any kind of stereotypes, but I think we have to be aware when we're looking at, caregivers that are out there, that there may be very different needs for different kinds of groups of people. Mm-hmm. And I think that's the same, when we look at caregiving across the age span, that, children are at different developmental levels than adults, for example. So, some of those supports and resources and advice that is required is going to be different because of that.
And another significant group too is senior caregivers.
Yeah.
According to the stats in Ontario, they represent about 12%, but that's probably going to grow because of the demographic bulge of older people.
And that's probably an underreported number as well. I would think that it is much higher right now than that particular statistic. And I think, what sometimes people kind of don't think about is that we put a lot on caregivers overall. For the healthcare system puts a lot onto caregivers, but a lot of caregivers also have significant health issues themselves. And of course, because we love our families, and of course, because we feel deep responsibility most of the time to care for our own. Sometimes we slip into a caregiving role and we don't even know we're a caregiver. At some point, what I see a lot of is caregivers who kind of get to a point of just so much stress and almost like a crisis point that then it kind of like, oh wow, I'm doing like all this work on top of everything else that I used to do, and I'm feeling really tired, but don't sometimes see that caregivers are people who have legitimate needs of their own. And I think we can get into this kind of situation where it's like, this is my mom, this is my job to care for my mom. But, and maybe not look after myself so well and not even realize, wow, I'm actually taking on, another kind of half-time, sometimes full-time job on top of everything else that I'm doing. And we do it out of love, and we do it out of obligation and respect for the person we're caring for. But on the other hand, we also need to consider that like we have needs too.
Mm-hmm. And a lot of caregivers talk about the potential for burnout. Some of them experience it.
Yeah. Yes, definitely.
Yeah. One thing that strikes me about the figures, that you quoted, I actually updated those, how much financially caregivers are contributing, because we don't have an empirical measure for things like love or devotion, obligation, duty, even desperation. So we tend, if we put a price tag on something, it's easier for us to visualize what it means in concrete terms. So the $133 billion that caregivers are contributing, and that's based on the assumption that the number of hours they're working, they would get minimum wage. It seems to me that they deserve a seat at the policy table. They're really holding up the healthcare system like that invisible piece of the iceberg. What are your thoughts on that, about getting the voice of caregivers to the policy and decision-making tables?
Yeah, I think it's crucially important. And I think, and it's not like people who have been working within caregiver organizations haven't been kind of calling for that for a long time. And, we've seen various provincial groups with very strong advocacy efforts. And I think now we have a new Canadian Center for Caregiving Excellence, really trying to push out, those kind of policy imperatives. And I think, so yes, absolutely. Caregivers need to be at those tables. They should be in all tables, decision-making tables that concern them, for sure. There's nobody that knows more about caregiving than people who have been or are engaged in caregiving. You can't understand it until you're in it. And I think there's nobody that I think would disagree with that statement who is or has ever been a caregiver. And so caregivers should be at policy and decision-making tables. They should be informing our research programs when we're doing research with. We should be doing research with, not on caregivers. And, and they should be really essential elements in developing educational programming and I would say in real and not tokenistic ways. And I think these are the kinds of things that, organizations like Compassionate Ottawa can really kind of bring to the fore. When you have an organization that is really committed to kind of creating a groundswell of people, that's the most power we have to make policy decisions. I always say to people, I've worked in healthcare for a long time. There's no better way to get a politician or, people in the health system to respond than having caregivers or, people who are getting care themselves doing and being engaged in that hard advocacy. It's vitally important. And, I remember a close colleague of mine, Dr. Harvey Chochinov, who many people will know from the palliative care community. And years ago, in one of the testimonies that he was giving to the Canadian Senate, saying, part of the issue is that in Canada, we don't have a vocal constituency for people who are caregiving and or are dying. And, often, dying people are dying. Caregivers are so involved in caregiving work, are so bereaved and exhausted from their caregiving experience. And so, I think about organizations like Compassionate Ottawa, where, there is potential for groundswell, from the voices of caregivers who actually could, really start to make some noise. And we really do need to start making noise. I mean, I don't think anybody on this call would disagree with me when I say we're in a bit of a shambles right now. Unless we as Canadians who vote our politicians in can really start to organize ourselves, we're going to continue to be in trouble. We vote, so we have power, but we only have power together. And I think, organizations like Compassionate Ottawa have the capacity to bring people together in collective ways that can really bring voice to issues like caregiving and other issues surrounding, care for people as they age and as their health declines.
Well, I remember when I used to be advocating on the Hill, Parliament Hill here with federal MPs on behalf of palliative care. And one MP said to me, and I was grateful for his honesty, he said, I have 50 good causes a day walking through my door. Why should I listen to you? How many voters do you represent?
Yeah.
Well, that got us started on a letter writing campaign and so on, and some things happened. But that's a big challenge.
Yeah, it is. And, I think we talked about this before, Janet, like I kind of like my background is in palliative care. I've been a palliative care nurse for 30 years. But my entry into palliative care was in the AIDS epidemic.
Yeah.
And I think we talked about this where I was like, 21 or 22. And what I witnessed was, I think even there were organizations called Act Up and Rise Up. Like there were such powerful AIDS activists that I think really turned the table on some of the policy directives and some of the supports. And I know it takes a tremendous amount of energy. I know it takes a tremendous amount of time. I was involved in those movements. But I mean, they made a difference. And that was everyday citizens. That wasn't, me as a nurse or a researcher. It was me, aligning with, people in community who really knew what they were talking about, were very invested in the issue. And we should all be invested in these issues across our country because, I see the solutions in community. That's where I see the solutions, not necessarily in community taking over, although we might actually make more sense in some instances, but that we actually do have power if we collectively come together.
Yeah, I'm also inspired. I like you, I really started most of my early palliative care work as a volunteer in AIDS care.
Yeah. And there's a lot of lessons. There's a lot of lessons to be learned out of that.
The slogan that they came up with, which has been adopted since by many other groups, nothing about us without us. Mm-hmm. In other words, don't make decisions that affect our lives without giving us a voice. Yeah. And not only giving us a voice, we're taking a voice.
Yeah.
We're not waiting to be invited. And
That's
the
right.
age
And
group,
we've
I think-
seen a similar kind of thing off that in the breast cancer community, for example.
Yeah.
Very active breast cancer advocacy community. And, I mean, the work is hard and it's a little challenging because, a lot of caregiver like we have fantastic caregiver organizations in many
Mhm.
provinces, but a lot of funding for caregiver organizations comes from government. So when I was the board chair of Family Caregivers Network, we had to really hold a kind of tight line in a way. We really had to be careful about how far our advocacy efforts would go, because a lot of our funding was coming from government. And so heaven forbid that, we would ever say anything or call out government, except in the kindest of ways. So, caregiver organizations have a bit of tension there. At least that's been my experience.
Mhm. But I find that often you find friends within government who
Yes.
work behind the scenes for you.
Absolutely.
And I've noticed particularly I noticed the Quebec Association of Caregivers seems to work quite closely with people in government and actually have them in the house and on their board
Yeah.
and so on. And
Yeah.
doesn't seem to be a controlling job. It seems to be
Yeah.
a communications and linking in job.
Yeah, exactly. And, I don't think governments are bad. I think governments want to do the right thing. And, and they should, that parliamentarian who said, why is your cause more important than the 50 other causes that are coming to my door every day? I mean, if we all stopped caregiving today, the healthcare system would collapse. It would absolutely collapse. They know the caregivers would never do that because we'll never do that to our families. But truly, the healthcare system would collapse. We are holding up the health and social care systems in Canada.
So
And-
if we,
Yeah.
sorry. If we get to
And
the
we
ta-
should be and caregivers should be recognized and acknowledged for that. And they should have seats at policy tables. Absolutely.
So when we get to the policy table and we say what we need, well, I've been looking around and I've attended some webinars recently. A lot of webinars going on about caregiving. And I think it's in the air now. There's a kind of something in the zeitgeist. But what a lot of the research shows that caregivers tell us what they need and what they want: information.
Yeah.
Where and how to access resources, understanding things like medications, how to provide care at home after bringing the care recipient home from the hospital. That transition is often very difficult. Help in navigating the healthcare system where there are multiple care providers and services. Training in basic skills of physical care, like how to lift somebody from a bed to a chair without hurting your own back.
Yeah.
Respite, rests, breaks from caregiving, just to be able to keep going. Connecting with other people so that they can learn and get out of that social isolation that's often a byproduct of caregiving. More home care services, some financial relief. For example, when you go home from the hospital, your medications in the hospital and your supplies are all covered by Medicare, but at home you're paying for them all yourself or by private insurance. So those are a kind of a grab bag of needs that caregivers say they want. Another one that came up recently in a conversation was that there needs to be training for healthcare providers about how to deal and how to talk and with caregivers and how to include them in the overall model of caregiving. So there's a big menu of things to tackle.
Yeah.
And
I mean, I think information, resources, creating resource hubs that are really like very pragmatic, easy to navigate information easy to find is super important. And I know that you know, there's many organizations that have resources for caregivers. And I think, you know, what we found in the research that I do is one of the challenges is knowing what kind of information to give when and when people need it. And I can't overemphasize enough that need for education for healthcare providers. Like, I think sometimes, you know, well, what we have found in research, say, that we're doing in home care is that, I mean, all the people who work in home care are trying as hard as they can to do the best jobs that they can with what in my opinion is a very underfunded home and community care system in our country. And so, you know, what we find is, you know, we're trying to teach caregivers how to give care with very little time to do that. So as a home care nurse, like, I can reflect back, you know, say 20 years ago in home care, you know, being when say we had a person who had palliative care needs. And, you know, I had lots of time to be in the home, sometimes a 1 to 2 hour visit, really sitting down with the family, really sitting down with, like, really trying to map out in some very pragmatic, practical ways, you know, how we could best support people, or what kind of resources they needed, or, you know, what is the context of that particular family situation that would help me understand as a nurse how I could best support you. And, you know, what we're finding today is, you know, there's a lot of pressure to get people out of hospital. So in home care, what we're seeing is a kind of prioritization of getting people out of acute care to meet those acute needs. But then those, you know, what some people might call like softer kind of skills are getting kind of deprioritized, but those are actually the most important ones. The relational aspects of care, being able to see 1 or 2 of the same providers in your home instead of, you know, the 10 or 15 that come through the home and don't know the family situation is, you know, that's not a well-functioning system in support of people who need care and the family caregivers that support them. So, you know, my top picks is, I think there are resources out there. I think some kind of really easily accessible resource hub is good, and a kind of, you know, maybe some kind of public awareness campaign that helps people to see that, yeah, like, I'm a caregiver and I don't know how to do this. I've never done this before in my life, except maybe if I've had a baby, and looking after babies is pretty different and toddlers is different than looking after, you know, my 85-year-old mom who needs help getting in and out of bed, or, you know, or I'm going to all of her doctor's appointment and I need to develop some advocacy skills to be able to help myself advocate for my mom. And we need to do something about home and community-based care in our sector, in our healthcare system. There's no, I think the last numbers I looked at, it's like, you know, $267 billion that we spend on healthcare in this country, in Canada, and we don't even have a clear number, but like $3 to $9 billion goes to home and community-based care. Where is the most care happening is in home and communities. That is where most Canadians are cared for. That's where most Canadians want to be. And so, and the way it's looking right now is that, you know, we don't have the resource in home and community-based care that we actually need to be able to support families in ways that we should be supporting them. So we need an entire shift in the way we think about healthcare in Canada in support of the people we care for and their family caregivers.
And that would be a big question at the policy and decision-making tables, I would think.
Yeah, it's a huge, and I don't know what you think, Janet, but like there seems to be such a tension. I know home and community care services are not in the Canada Health Act. So they're not, you know, in that kind of insured group of services. You know, a lot of families are being placed in positions of having to hire care privately, which is unaffordable for a lot of, like, probably most people. And yeah, I can't say enough about resources, information for caregivers as a high priority need, and bringing together, like I noticed in the chat, there's lots of people saying, we've got this resource here, we've got this resource here. But it's almost like we need a resource hub. Like, I think everybody, if I looked at all of those resources, a lot of them might actually have the same kind of information. So how can we create a something where, you know, there's the one or two places to go that caregivers can grab that kind of information, because it's essential. We see in our research, one of the most important predictors of better quality of life and better health for caregivers is how prepared they are for the caregiving role. So we know information actually, and that preparatory information actually does a lot to improve the quality of life of the person giving care and the person they're caring for. There's we know from the research that you know, people have, you know, less depression, things like depression, burden, overwhelm, burnout, when they feel prepared and when they can get, like, I think one of the really, like, even like I think about in palliative care, in some areas, we've had these like 24-hour response teams. You've got 24 hours a day, you can call somebody and you can get an answer. And I think caregivers need the same kind of thing. Like, you know, oh my God, somebody's just fallen on the floor and I don't know how to get them up. And like, I'm going to call 911 and, you know, and like, what do I do? You know, and people need answers and they need it quick, and they need it from people who know. And people who really know are people who have been through the experience with maybe some support from the health system.
Yeah, and I noticed that some of the provincial associations do have helplines and resource centers, and people can call in either with a practical question like, where do I rent a hospital bed, or what do I do? He's fallen. But also they can call and be connected with other caregivers so that they can share the wisdom that they've gained through the experience of caregiving. Yeah. And maybe what we could do is focus down now, maybe on the community level. To what can, because community, Compassionate Ottawa is asking itself, what can we do to serve an estimated at least 250,000 caregivers in the city of Ottawa alone? How can we create a resource hub? And I look at the AIDS model again, the Canadian AIDS Treatment Information Exchange, which is a terrific model. It was very expensive to set up and maintain. But I wonder if something like that can be created at the local level.
Yeah, it's like a clearinghouse. It's a clearinghouse of information. So instead of, you know, spending the, you know, 8 hours of time that you don't have to be searching out information, that there'd actually be a clearinghouse, and, you know, there'd be a tab there that says, you know, how do I access Red Cross for equipment, or, you know, whatever. And I think the other thing, like one of the most powerful things in my own community that I've seen that was a very grassroots kind of community-based effort was just in the hospice organization that I collaborate with. There was a group of volunteers at the local hospice who started what they called the hospice walking group. And this was basically you know, a group of people that just got together. There was just a location on a Saturday morning where people got together, you know, you showed up or you didn't, and they just went for a walk together. But I had walked in that group many times, but the things that happened in that group were like incredible. Like, you know, I'm going through this. Oh, you know, I went through that too. Like, what, you know, what do I do? Oh, here's what I did. Like, it is that peer-to-peer sharing of information that I think is just incredibly powerful. As I said before, it's, you know, when you've been through the experience, you've been through the experience and you're the expert of that experience. And, if I just only put my nurse hat on, and I mean, I have been a family caregiver, I really understand that experience. But if I didn't have that experience and I just put my nurse hat on, I think I would understand things in a fundamentally different and not as informed way, I might say.
Yeah.
So I think Compassionate Ottawa, and other cities that are looking to develop kind of similar models have a tremendous capacity. I understand that you're not direct providers of healthcare services, but again, it's coming back to that issue of power in community, a clearinghouse for information, maybe some white papers and policy papers that kind of continue to push the information forward, webinars like you're doing on various topics, and maybe trying to think about some kind of, like, I do think a public aware, like we've talked in palliative care, say for many years, people never understand what palliative care is, but I think some people don't actually understand what caregiving is until they're right in it. And they don't have the time or the energy to actually be doing that kind of work to make the public aware of what is out there already, the good work that's already been created by many organizations across Canada. But we don't always also recognize our own power as people in community. And I followed the kind of development of compassionate communities around the world. And I always think, we think about gestures on grand scales, but actually the most important work is done locally in communities with people who understand local community contexts. We see that time and time again across many countries in the world. I think the kind of model that Compassionate Ottawa is embracing is a model that I think we're ready for. I think we're just really ready for.
And I think one of the first challenges, as you say, is getting people just to self-identify as caregivers. And that's where a public awareness campaign can come in. And also one of the fruits of that seems to be, from the statements I've heard from caregivers, is that once I start to self-identify as a caregiver, then I start valuing that role, and I realize I'm playing a socially useful role. It's not just me in my corner, and then I'm part of a movement, and I personally am one of the bricks holding up the Canadian healthcare system. It's just to value that, and have people thinking, well, maybe I should reach out for resources and not try to do it all on my own. I think the other thing that I guess I want to say, and I'm sensitive to the fact that there might be caregivers on the call who are really, really struggling, and I just want to say also that sometimes enough is enough. Sometimes we can't continue to do what we're doing without jeopardizing our own health and the health of the people we're caring for. And I think that's why, like, respite care programs, for example, are kind of important if they're designed in ways that actually give caregivers a break. My experience with caregivers has been that, we offer respite care, but then caregivers end up coming to the institution where the respite care bed is every day, or, they're not, or if we provide respite at home, that, unless we're having kind of some good continuity of care, caregivers are kind of not wanting to leave home, because of course we always know that we are the person who knows the person, our family member or otherwise, best. So I want to say to people, it's also okay to say, just, I need a break from this, and I can't actually do this anymore without really jeopardizing my own health. And, I think what happens sometimes is that we do so much to hold the system up.
and sometimes it's okay to say, but we really need support from the system as well to help us to continue to do what we're doing, if that's what we desire to do. That, you know, we have to kind of take off that martyr hat and say we can do everything we can, you know, because sometimes we can't. It is absolutely the case. We can provide lots of information. We can do all kinds of things. But at the end of the day, we also need to realize that sometimes we can't do everything. And there can be really ill effects from caregiving on an ongoing basis without having those opportunities for breaks, without having opportunities to recharge our own batteries. And it's also okay sometimes to say, I just can't do this anymore.
Yeah. And then what happens? Yeah.
Yeah. Well, you know, I mean, I think that's a whole other conversation about, you know, like, you know, I think one thing that COVID has shown Canadian society is that, you know, long-term care is a place now that a lot of people don't want to go. And that's a place that, you know, when we say I can't do this anymore, that's a place where a lot of folks end up being. And it's not that long-term care people in long-term care are bad. There's excellent care in long-term care, but it is also a system, just like home and community-based care, that is not well supported. And given the demographics of our population, you know, of course we need all of those acute care services, and we want emergencies to be there and surgeries to be there when we need them. But we have a lot of people who would be better positioned in other places if they were funded properly to do so. Acute care and long-term care is one of those places. I remember years ago, I worked in long-term care. It was a wonderful place to be. But I think, you know, successive lack of funding to long-term care is also, and the people going into long-term care are much more frail than what they used to be 20 years ago. So, and some people might argue with me, but in my view, in many provinces across Canada, the average length of stay in long-term care is like less than 2 years. So they are kind of de facto hospices, and we should really be thinking about how we integrate our philosophies around palliative care into long-term care in some real ways.
That's an interesting point, because I heard Andre Picard recently, the Globe and Mail health columnist, talking about that. And his point was that because the COVID epidemic has exposed an awful lot of abuse and neglect in some long-term care facilities, excuse me, that a lot of people are just reticent
Yes.
about going into even touching,
Absolutely.
you know, and feeling guilty if they have to even think about
Yeah, no,
and-
absolutely. And
yeah.
that guilt is like real, like, you
Yeah.
know, and what I hear from caregivers often is, you know, the people that they're caring for, maybe they've had not a good experience in hospital, or, you know, they're seeing what's going on in long-term care and saying to their family members, please don't ever, like, don't ever put me in one of those places. And the family caregiver going, of course I won't, I will not do that, I promise you. And boy, that promise is hard to break. And so, you know, we have, along with actually providing good supports to keep people at home and in communities, and support caregivers to do the work if they want to do that, we also really need to be thinking about how we can better support through our advocacy efforts the work that is happening in home and community-based care and long-term care, because nobody should ever feel guilty if they say I just can't do this anymore. But we're not going to rid people of that guilt if they feel like, you know, the options are so poor. And again, it's you know, I always want to say that I don't think inherently, I mean, I've worked in the system for 30 years, and there's very few people that I've met that are bad healthcare providers. but the systems and structure and the way things are structured and the systems that we have don't support people to do the work that that they were trained to do and that they went in to do in the first place. There's nobody, I even take broadening it out broader. I look at what's happening with, say, nursing shortages across the country and people leaving nursing, and nurses are not demanding higher pay. They're developing better work environments for the places that they work, because nobody wants to go to work thinking, today I'm not going to be able to give good care, or today I'm going to give unsafe care because there's not enough of us, or the system isn't structured to support us.
Mhm.
And the people that work in the system don't want that either. Like, there's no evil people out there, but we've had all kinds of reports about health reforms in Canada, including recommendations on how to best support family caregivers. And, we just need courageous government to act on them.
Yeah, it sounds like what you said, that gives us an idea that maybe we could consider at Compassionate Ottawa is setting up a dialogue between caregivers and healthcare providers.
Yeah, I think that would just be such an excellent idea.
Yeah.
The
Really-
solutions lie with caregivers and the people who have experienced care within our system.
Yeah, and I was encouraged to hear recently the Ontario Caregiver Organization had a pilot program in Algoma region of Ontario, working with an integrated Ontario health team and bringing in caregivers as full partners in the decision-making process and redesigning the system essentially.
Yeah.
And it seems to me that we, as Compassionate Ottawa, could play that facilitator role.
Yeah,
And maybe
absolutely.
have a pilot project. I mean, we have a good healthcare system here, and a lot of people that would be willing, I think, to engage in that kind of dialogue.
Yeah.
I really like that idea.
Yeah.
So we're thinking about public awareness, raising awareness, creating an information hub, perhaps facilitating dialogue between healthcare providers and caregivers. That seems like a pretty good
I think that's a great
to-do list to get started.
I think it's a pretty healthy to-do list, and and I think these kinds of steps are necessary, and then I think it's, I mean, I guess because I started in AIDS, I'm an activist at heart.
Mhm.
So I'm just like, we need to rise up. We need to rise up and say, we, like, this issue demands attention. It demands attention from our policymakers. It demands attention from our health system partners and our governments, as actually a core pillar of the healthcare system.
Yeah.
Caregivers are holding up the healthcare system. There's no doubt about it.
But it's really exciting to think about that possibility.
Yeah,
And I'm sure that a lot of healthcare providers would welcome, the professional care providers would welcome that
Totally.
as well.
Yeah.
I think everybody realizes there are problems. And I think part of that dialogue too would be helping caregivers to learn how to navigate the system.
Yeah.
While changing the system to make it more easy to work within. But so many people say, I've got 5 physicians, 5 different people giving out prescriptions. I don't know who to talk to. Are they all talking to each other? No. Who do I call about this particular problem? Where do I go? So I think that can be all rolled into good topics for discussion.
Yeah, totally. Yeah,
Not only
absolutely.
navigating the system as it is, but how can we transform it into a healthier, more responsive system for everyone?
And I think when communities become a part of that process, they have more ownership around that.
Yeah.
And being involved and engaged in creating something different and better and new is a wonderful, it's a wonderful experience. And I think, places like Compassionate Ottawa, I think it's kind of that the whole kind of philosophy behind these behind compassionate cities and compassionate communities is how do we work together collectively as communities to support each other, whether that's like in your neighborhood with your neighbors or, your mom friends at, that you've met from school or your family itself or, or people that you meet through organizations like Compassionate Ottawa.
Yeah.
You guys have a good thing going there. Like I felt so inspired before everybody came on the call that like the three kind of people who are staff of Compassionate Ottawa don't have gray hair like me. Like there's young people worried about these issues and wanting to step in. And I think, I have 2 teenage daughters, like they want to live in a good world. They want to live in a society that, cares for one another. And I think that's what we're all striving toward.
Yeah. And I'm sure it's not an us versus them situation either, caregivers versus the system.
No,
it's really, the system
it's
is
really
human
coming
beings
together.
too.
The system, the people in the system are also us.
Yeah.
They want to do a good job, and by and large, they are doing a good job. But everybody needs support and help, and it's so much better doing things collectively than on our own. And that's been my experience, over the last 30 years of working with caregivers, is that, when people come together in groups of people, that there's so much positive that comes out of those interactions. And there's so much capacity in kind of peer-to-peer kind of support and guidance.
Yeah, well, it's very exciting. It also creates more resilient systems, I think, too. Yeah. And I do want to say we have some marvelous things going on here in Ottawa and some good respite programs. And there's actually a basic skills training program, a shout out to the Champlain Hospice Palliative Care program that started a 6-week basic skills for caregivers. And I went to one of the sessions just to hear what was happening. And one of the women said, I've been taking care of my husband at home for 6 years. And I've had a sore back for every day of those 6 years.
Yeah.
But since we had the session on lifts and transfers, my back pain's gone away.
Yeah.
And I just think, we've got some really good things going in the community.
Totally.
It's very exciting about bringing it all together. And
yeah. Totally.
I can't
and the programs are out there. Like lots of organizations are running programs like the Champlain Hospice, and those, you can't underestimate the power of those kind of practical kind of skills workshops. Like they save your back, they save your, it's just caregivers say, I don't know how to do this. And I think the other thing is, when you mentioned, Janet, around education for healthcare providers, sometimes, and I'm talking for myself as in my position as a nurse, sometimes we forget that, like all of these things might come very natural to me as a nurse, and I forget that, like people don't know how to do these things. Like people really need to be shown step by step sometimes, how to do certain things. Like giving people medications is a skill. It's a skill I went to school for. I think of the work that I've done in palliative care and around pain management. Like this is a very complex skill, and families are afraid. Families are given the responsibility to help manage, their loved one's pain. And it's like, what if I give a medication and somebody and my loved one dies? Like it's a scary thing. So, there's a lot of learning that has to happen. And so, as a healthcare provider, I always will say to myself, okay, I'm just going to pretend that this person just knows absolutely nothing about this. Because if they know a lot, that's great. They'll tell me where I might be getting it wrong or improve my teaching. But like if people don't understand, these kinds of things that have to be done, it puts caregivers at risk. It puts them at risk for injury. It puts them at risk for their own ill health. So we need to use, practical, very practical kinds of skills, kind of things that people need to know in ways that are easy to understand and easy to access.
Yeah, thanks. And I see that Paula has said we have a lot of questions waiting. So I think it's time for us to engage with community.
Yeah, wonderful.
And hear the questions that people have.
And
Yeah.
I just have to do a shout out. Everybody will see in the chat that there's a message from somebody from Diaper Row in Sioux Lookout, and that is, I just want to say hi to my very good friend George Nickerson, who also was a caregiver to my lifelong friend, and I've learned so much from that experience.
That's great. Thank you. Paula, what
Thank
do we
you
have?
both.
Yeah.
Thank you both so much, firstly, for the conversation that we've been so lucky to hear today. And thank you as well to all of our attendance members that have been putting resources and stories in the chat. I would just like to assure you that the resources that have been left here will be included in the follow-up email that you'll all receive tomorrow. So you don't need to rush to try to copy those. They will be sent to you. And thanks to those of you that have submitted questions. We will get into those right now. Our first one says, I'm interested in caregiving at a distance, also a challenging role to live. Getting the help lined up online, supporting by phone or Zoom, keeping a relationship alive, etc. And the problem of being branded by others on the outside as a relative that doesn't care enough to be on the spot really caring. Do you have any comments about that?
Kelli?
Yeah.
Suzanne?
Yeah, I mean, that is always a challenge. And I think also, what often happens with people who are caregiving at a distance is, well, first of all, what I would say, I would acknowledge that caregiving at a distance is really challenging. And it's not, there's no such thing as a caregiver. A caregiver isn't defined by where you live. So you are a caregiver, that people are kind of commenting that, you're at a distance and maybe you don't, really care. That's not true. Most people, because we have families now that live all over the place, most of us will have a caregiving role at a distance. Absolutely. And, I'm not sure that there are easy solutions. It's always, even when you live in the same town as the person that you're a caregiver for, it's always a challenge to navigate resources, navigate systems, and it's even more so a challenge at a distance. And I guess, it's kind of thinking about, what province are you in? Are there caregiver associations in the province that you're in that might be able to provide some support or advice around, that particular issue in your setting? I think anytime that you can, if you can't be there in person, anytime that you can be involved in conversations at a distance by Zoom where you can see people. I think the other thing that sometimes happens is that, sometimes families that are at a distance, that they kind of feel the effects of not being there and not always being kept in the loop. And so sometimes you're entering, some of the conversations with not all of the information that you need. And so really trying to make sure that, you're included in the loop. If there's, phone calls or video conferences with doctors that you can be involved, or nurses or the home care team. I don't know, Janet, if you have anything else to recommend.
Well, I was just thinking, because I grew up in the Maritimes, and then, families would disperse to the rest of the country, and they would always say, oh, she has a daughter in Toronto. And I think of that daughter in Toronto, because now I'm left the Maritimes too. But I think now if I could call somebody in Lunenburg, for example, or the Caregiving Association for that area, at least I could plug into what are the resources in that area. Because if I'm sitting in Ottawa or Toronto or Vancouver, I don't have a clue what's going on in that city, and I don't have the network that could easily tell me that. So I think connecting too with the local resources in the community where your care recipient is living is really important. And I've noticed that people in rural and remote areas, some caregivers have set up chat groups so that people in rural remote areas can talk with one another and get clues and for caregiving, but also information sources. So those can be precious. Sometimes when the system can't respond, other caregivers can out of their own knowledge. Yeah, Paula.
Great, thank you very much. Our next question says, the government says that a caregiver can receive a tax credit to help them, but the credit is based on a very low household annual income. This means that few can access the benefit. How do we advocate to have this benefit expanded?
Make noise.
Yeah.
That's where advocacy comes in, I think, because I agree with you. I looked at those provisions myself and I thought that's a very low family income threshold.
Yeah.
I think that's a question for advocacy, and that gets back to our earlier conversation too, about bringing the voice of caregivers to the political and policy making table. So
Yeah, I
do you
think
have a better answer, Kelly?
Well, not a better answer, but maybe just in addition to that, I know I was years ago involved in some of the research that was evaluating Canada's compassionate care benefit. And you know, sometimes we did an evaluation of that benefit because we knew that you know, when it was first developed, for example, that there was some limits to you know, what was in the benefit, and it disadvantaged certain groups of people. And the example I'll use is that I think the original legislation was, you know, to provide benefits for people who were related family. And one of the things that came out of our evaluation was that there are many friends and, you know, not biolegal family members that are providing care, and really pushing through our research findings to advocate for a broadening of the definition of family, which I think we were able to achieve. So, you know, there are a couple of like those kinds of, if those policies and those legislations are not working well, advocacy is one way, and also advocacy with data is another way. Like one of the primary reasons that I went into research is that I figured out that I might actually be able to do more good sitting outside of the health system than inside the health system, because I had so I do a lot of work with health system partners and with government, and trying to kind of bring to light like issues like this that aren't working for, you know, all families in Canada. So, you know, there's a researcher, I think at McMaster University, Alison Williams, who's been doing a lot of work around, you know, caregiving and employment and benefits and policies around that. And she led that compassionate care benefit evaluation. Maybe this is something that needs a reevaluation, so that when you go to do your advocacy work, that in addition to very compelling stories that will come out from caregivers that are having experience with these policies, that we actually have some data to back that up as well. I mean, I know you and I talked about this, Janet, but one of the things that is a little bit tricky in Canada is we don't have a good way of, there's not, aside from kind of the Stats Canada data that is collected, we don't have a good way of kind of over time collecting information on what's happening for Canadian caregivers. And, you know, our research institutions don't tend to fund those kind of long-term studies. And we actually do need that data. That data helps with advocacy, absolutely. So that's just a pitch for anybody that has any power to, you know, in some philanthropic organization that wants to fund, you know, longitudinal or over time collection of data on caregivers. It's really important for our advocacy efforts.
Mhm. Yeah, it's not as splashy as some of the more immediate
No.
payoff programs, but it's highly essential.
Yeah.
Absolutely. Yeah. Good. Paula, yeah. Time for
Thank
another
you.
question? Yeah.
Well, unfortunately, we have actually reached the end of our time today for this conversation. I would like to invite Monica Patton, the chair of Compassionate Ottawa, to come on back and give us some closing remarks. And before she does that, once again, Janet and Kelly, from me and the staff at Compassionate Ottawa, would just like to thank you again. Monica.
Thank you. And thank you, Kelly.
Thank you, Janet.
Indeed, thank you both. This has been an amazing afternoon, and I am all I can say is wow about the data and the suggestions that you have made to us, the stories that you've told, the numbers that you've given to us. And I guess one of the sentences, Kelly, one of the statements that you made that I wrote down in the many notes that I've kept here was, we are in a bit of a shambles. And then you went on to demonstrate exactly more than a bit, I would say, of shambles. And you told us exactly where we find ourselves in this country and what some of the big actions, the big challenges and the big actions are that we can take. I have to tell you that I can't wait to take your call to action back to my Compassionate Ottawa colleagues, board and volunteer colleagues, and colleagues around the city with whom we work and partner so closely, and see what we in this community, the city of Ottawa and around us, can do to rise up, as you used that language as well, Kelly. So thank you both so very, very much, Janet and Kelly, for this both stimulating and inspirational, if somewhat sobering afternoon about a reality that 9 million Canadians and all those people around those 9 million Canadians are facing. Thank you very much for that. Thank you all for joining us this afternoon. Let me invite you to mark January the 25th in your calendars. That's in 2023, where we are going to have Compassionate Ottawa volunteer Jack McCarthy in conversation with Dr. Jeff Turnbull, a well-known local physician. Kelly is nodding her head. I bet you know Jeff Turnbull as well, Kelly, a well-known physician across Canada. And Jeff and Jack will talk together about how we in the community and the healthcare system healthcare providers can work more effectively together. And he will also talk with us about compassion for those people who are most vulnerable, who are living in poverty and who are vulnerable in our community. So that's January the 25th. That's all I have to say. I want to invite you all to consider a donation to Compassionate Ottawa, and you can go to our website, which I think will be on the screen, and you can find the Donate Now button. And if you can make a contribution, that will help us to continue with wonderful programs like this. As I close off, I wish you all the very best for the coming holiday season. And as we look ahead to 2023, let's work for a year where there is compassion for all. Thank you so much.